My name is Laura Geraldina Pradilla. I'm an associate professor of medicine at Columbia University and director of the Lupus Clinic.
I'm Anka Askanase. I'm a rheumatologist. I'm the director of the Lupus Center here at Columbia University. And today we're going to be talking about lupus. Because things are so complicated and because lupus can affect any part of the body, I think it's very important that your lupus is taken care of by people that know lupus, understand it, and are very well versed in diagnosing, treating, and taking care of people with lupus.
Lupus is a disease of the immune system, so that means that those cells in our body that are usually there to fight things like infections or foreign things and malignancies, they start attacking your own body. So depending on which things are being attacked at a time, a lot of different symptoms can happen. And usually this disease affects mainly young women. So we're talking about women in their childbearing years. And we also see that there's more that we see this disease more commonly in different racial ethnic groups. So we see that it's more common in Hispanics and Blacks, for example, when compared to whites.
The most common symptoms of lupus are fatigue, rashes, and joint pains. But of course, lupus can affect any part of the body, be it headaches, be it chest pain, be it fevers, abdominal pain. All sorts of symptoms can be part of lupus.
But the most common symptoms tend to be affection of the skin. So we see rashes, the most common one being like a butterfly rash that most people are familiar with. But it could vary from individual to individual. The joints tend to be affected very often too. And usually when that happens, we see swelling in the hands, in particular in these parts here around the fingers. But again, it could potentially affect any organ in the body and give different symptoms depending on which organs. And there are some of the affections that don't give you any symptoms at all. So because of that, it's always important to be checking in with your doctor, checking things like blood work, urine, because that gives us some idea of other things that could be involved.
So you need a rheumatologist or a lupologist to be part of your team. If other parts of your body are affected, like the kidneys or the lungs, or the heart, or the brain, you need doctors that can help with the management of this particular part of the body. So lupus takes a village. You need people for support. At home, you need people for support. In the healthcare system, you need help because lupus is a chronic disease. We don't know a cure. We don't have a cure. So think of lupus as you would of someone with diabetes. It needs to be managed, and it needs to be managed every day. The day when you forget to manage your lupus is the day when lupus can get ahead.
The main goals of treatment in lupus is to control the immune system so that we prevent damage of the organs, and also so that in the long term, we have good favorable outcomes in health so that we don't suffer the complications from having organ damage, and also to not require too much of immunosuppressants or medications like steroids that are often needed during flares and can also come with a lot of side effects.
So work with your doctor to make sure you understand the medications that you're taking, their role in making lupus better and keep it under control. And probably equally important is to have emotional support, be that in your home, in your family, or a health professional that can help with that. And the more people that can help take care of your needs are around you, the easier it's going to be